We are continuing our discussion on the coronavirus or COVID-19 pandemic. With new case numbers on the rise throughout Orange County and throughout Florida, which has been dubbed the new epicenter of the virus, this leaves many residents questioning what they should do next. Face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we are going to get an up-to-date look at where we are as a community dealing with this pandemic. Now let's get an update from our local medical professionals, and joining me is Alvina Chu, Epidemiology Program Manager with the Florida Department of Health in Orange County. Thank you for joining us, Alvina. I wanted to ask you about the coronavirus numbers because there seems to have been a spike. What are the current numbers?
So currently in the state of Florida, there's over 400,000 cases and over 5,600 deaths.
Now, I know one thing that you want to stress is the potential for multi-generational transmission of the virus. Tell us about that and what we need to do to avoid it.
Sure. So I think a lot of people, if they've been following the outbreak since the beginning in the spring here in Florida, if we were to look at who was getting infected and who was getting seriously affected by the COVID-19 infections, it was those who were older and who had serious comorbidities. And then we put in a lot of social distancing measures and a lot of efforts to flatten the curve so that we could reduce the number of persons who are severely affected. If we look at what's happening now, you could clearly see just by the age breakdown that the persons who are getting infected mostly now are persons who are younger. So the median age in Florida and in Orange County is currently about the mid-30s. It fluctuates a little bit, but it's around the mid-30s. And so this means that most of the people are younger, the ones who are getting infected. But if you look at the next graph over about who's getting hospitalized, so after infection, who's getting more seriously affected? It's persons who are older, such as those who are over 50. And then if you continue down the disease spectrum, if you look at who is dying or who is at severe outcomes for COVID infection, it's persons who are much older. And so essentially what we're seeing is that younger people who are going about their ways are potentially bringing back the COVID-19 infection to persons who are older and persons who are more likely to have more severe outcomes. So your parents and your grandparents potentially.
Oh, wow. Is contact tracing one of the key components to us reversing this spike? And for those who don't know, what is contact tracing?
So contact tracing is really trying to get at the bubble around a person who is infectious. So when we identify persons who are positive for the SARS-CoV-2 virus, we look to see during what time period are they shedding the virus or able to infect other people. We try to get them to let us know who have they been in close contact with, because we know people who are in close contact are more likely to get the disease because of the transmission. The transmission is primarily person to person through droplet contact. So close contact, droplets fall out within 3 to 6 feet from you. And this applies to people in your household. So we see a lot of household clusters. So persons who are infected can easily infect persons who are in their household. So if you're a young person living with your parents or your grandparents, sharing this close space, and I don't know the last time you wore a mask in your house the whole time, but most people don't wear a mask within their house, and so it's difficult. And so we want to let people know if they are positive and infectious to separate themselves from those who could be vulnerable, and this means even in their household. And this also means staying at home if you are sick. And so this is what we call the self-isolation, is removing yourself from staying at home from your workplace or from gatherings or from other places where you might be in close contact with people and you might continue to spread the virus.
And with the rise in coronavirus numbers, I would imagine that there's also a rise in hospitalizations. How are the hospitals here in Orange County handling the influx of people? Are they overcrowded now?
So we've been working with our hospital partners to address the medical needs of our population. And so if you look at there are some numbers about ICU bed occupation on the state of Florida website. ICU beds are not over capacity at the moment. And so I know all the hospitals have been doing a lot of planning to create surge capacity in the event that there might be a need for additional beds.
And we've asked this question before about hurricane season, which is we're in right now. How should shelters handle people, particularly during this pandemic, and those with special needs?
So we have been working with our emergency planners to still continue to try to institute the good standard practices that we use now outside of an emergency. To try to maintain good social distancing, separation between clients, the possible use of barriers, good hand hygiene, and specifically wearing of a face mask or facial covering to contain anyone's droplets. So specifically trying to break the chain of transmission between persons who might be infectious but not know it. And so I understand even in a shelter, we would try to maintain these kinds of measures.
And one of the things that they're using, we're hearing a lot about, is convalescent plasma in hospitals to deal with those who are diagnosed with COVID and having acute issues related to it. Tell us about how convalescent plasma is helping to improve survival rates.
Right. So there isn't specifically a really good regimen. There are some drugs that we've been using to try to help treat the symptoms of the coronavirus infection. But convalescent plasma can be a very specific way to address in the absence of a vaccine and in the absence of any specific treatments, a way to help alleviate symptoms and aid recovery for persons who are currently acutely ill. So what we're looking for are persons who have confirmed previous SARS-CoV-2 infection and who have recovered, and then who have developed a good level of antibodies for them to donate plasma. So their antibodies that they've created to fight the viral infection themselves could be used to help someone else fight that viral infection, someone who could potentially be very sick. And so, people can donate through oneblood.org. There is an online registration site for persons to do that, and there would be, especially with the increase in cases, there would be a great need for anyone who has previously recovered.
Now, we should all wear our masks, social distance, and of course wash our hands, but businesses also play a role in helping to reduce the spread. How can businesses become more compliant here in Orange County?
Right, so with the relaxing of some of the social distancing measures, there is still the county's executive order to wear a facial covering while in public, and that's to help break the transmission. The mayor has recently convened a multi-agency task force that's comprised of Orange County Code Enforcement, the Florida Department of Health in Orange County, and also Orange County Fire and Rescue. We have teams that go out to assure compliance and to just provide education and also to provide assurances to the general public and also to businesses about the measures to help maintain social distancing. Part of that includes, ready access to good hand hygiene supplies. So, the basics you'd want in a restaurant, like soap and running water and paper towels so that you can wash your hands properly. But also visual cues for social distancing, those markers that you can see in many locations about if you're going to queue up to maintain the 6-foot distance. And then also signage so that persons who are inside the businesses can, a visual reminder to just maintain your distance, wear your mask, and wash your hands.
I think this is the most all of us here in Orange County have ever looked at the floor when we walk into a business because we're looking for where we should stand and being compliant. Alvina,
Exactly.
Thank you so much for being with us today.
Thank you so much.
And we'll be right back with more. Stay with us. Our next guest was on this program early in the pandemic and is back to give us an update. Karen Broussard is the Vice President of Agency Relations and Programs for Second Harvest Food Bank of Central Florida. Welcome back, Karen. And can you give us an update on what's happening at Second Harvest since we last spoke?
Yeah, hi Clarence. Very nice to be here again. Thank you for having me. Since we last spoke, we continue at Second Harvest to see a need that requires us to double the amount of food that we are producing and sending out into the community. So we're pre-COVID again. We were at about 150,000 meals a week. We're now generally distributing in the neighborhood of around 300,000 meals a week. We have continued to innovate, and some of the programs that we sort of developed on, on a dime, as it were, at the very beginning of the pandemic are now up and running really well, very fully. One of them is a home delivery program. We always knew that there was a need for that, particularly for isolated seniors, folks who are homebound, disabled, etc. We had a small volunteer driver program that was getting us we could distribute about 50 meals a week. We're up to in the neighborhood of 1,000 plus a week at this point in time. We've come up with a model that's working really well. Very pleased with that, and we feel like it's having really significant impact into the community. And it also it hits all counties that we serve, obviously a big impact in Orange County. More community partners are on board with us, and we're all working collaboratively, which is having even greater impact than ever. And in addition to that, our SNAP Outreach Application Assistance Program has now gone to a completely telephonic model. That is enabling our team, and we've added 3 additional people who are able to speak Spanish and Creole, in addition to English, can now assist people through by phone to be able to get assistance to get SNAP benefits into their household. So those are some of the innovations that we've done. We have not seen any reduction in the need at all. We expect to be able, we're going to wind up having distributed about 92 million pounds of food this year, which is a vast, significant increase over any year in the past. Very shortly, we will have surpassed the height of the distribution numbers and the people that we're serving from the years of the Great Recession. We also understand that there will be greater need coming really soon as unemployment benefits are going to run out. And we know that there will be continuing layoffs and furloughs coming as companies try to, navigate their way through the pandemic. So we continue with a lot of energy to try and meet the needs of the community. We continue to work with our partners, and we are doing everything we can to understand what those needs are in the community.
It's good to know that you're handling the increased demand. I do want to ask about people who do need help. How do they qualify for services from Second Harvest?
Yeah, that's a great question. There really is no qualification process. The primary way that the food bank gets food into the community is through a very large network of about 550 other feeding programs. Honestly, in Orange County, it's about 230 of them. So all anybody needs to do is go onto our website, which is at www.feedhopenow.org. They will see a button there for Need Food. Go there. There is a link to a map that people put their address in, and it maps out the pantries that are closest to them, including the days and times of distribution. And so they'll be able to find all the information on the website pretty quickly with a couple of clicks, and be able to find out where to go for food. Once they get to a pantry, there is no qualifying criteria at all. We feed anybody who says that they need food at any time. So that's how people get food.
And I noticed on your website something called the Bring Hope Home program. Tell me about that. How does that work?
I did actually, Clarence. That is our home delivery program that I mentioned at the start when we were talking about the innovation that we've come up with. That is the home delivery program. And in that case, folks either can self-refer, or they can either self-refer, or they can be referred by another organization or entity, where they do. In that case, there is a qualifying process, and it requires about a 6-question survey, and then most people qualify at this point in time.
Second Harvest is doing such critical work in the community. How can people help?
Yes, well, several ways to help in this environment. We rely on volunteers tremendously. That is how we get most of our work done. Well, not most of our work, but a significant amount. Currently, obviously, we're following very, very strict COVID and CDC guidelines for safety. However, we still are using live volunteers in the warehouse, but much fewer than we used to, and much further apart, so that we can have social distancing, masks, gloves. Everybody who comes into the building gets temped when they first come in, those kinds of things. So one way is to come in and volunteer, and you can sign up for that again on our website. Another way to help the food bank really is to donate. And you can create a virtual food drive, which we prefer. We really are not encouraging people to do regular food drives at this time. We don't think it's particularly safe at the moment, but virtual food drives, and if you go on the website, we can help you, walk you through how that happens. Every dollar that's raised really has a value of $9 for us. So that's an important sort of part of the equation for how the food bank can be helped. Donations are really the best way at the moment.
Well, Karen, thank you very much for joining us again. It's good to see you.
Okay, thank you so much, Clarence. I appreciate it.
We'll be right back with more. One thing that will definitely bring about a giant step toward getting back to some sense of normalcy is the return of professional sports. Joel Glass, Orlando Magic Chief Communications Officer with the Orlando Magic, is with us to talk about the return of the NBA in this age of coronavirus. Joel, thank you for being with us and joining us from inside the NBA bubble.
Great to be here, Clarence.
You know, lots of sports fans are excited about the NBA resuming its regular season. How will these games be different?
Well, we went into the bubble July 7th, and there are 22 teams here playing at Walt Disney World at 3 different venues. We'll play 8 seeding games and then the regular NBA playoffs. So it should be regular basketball for the fans. The one difference, obviously, there are no fans, but the games are going to be made for TV.
And for those that don't know, we're calling the location of the games inside the ESPN Wide World of Sports the bubble. And what kind of precautions are being taken to keep the players safe and also the other personnel who work for the teams?
Well, health and safety is a priority here. And each team has 37 people here, including players. Every morning there's a health app that you take your temperature, you take your pulse oximeter to get your oxygen levels. You have daily coronavirus testing. And then also there's some sensors on our credentials that beep when we are too close to someone else. So it promotes social distancing. And everyone is wearing a mask, which seems to be the most important thing.
That's excellent. That's excellent. You know, the Magic have been a really good community citizen here in Central Florida. Tell us about some of the investments that the Orlando Magic is making philanthropically in the community.
Well, for starters, the DeVos family, which owns the Magic, took care of all the arena workers and paying their salaries for games they would have worked that were missed due to the coronavirus. And on top of that, the Orlando Magic commits $1 million a year into the community, mostly focusing on youth programs or youth at-risk programs. And it's just a way of life for us at the Orlando Magic.
That's excellent. And also, just a little bit of sports talk here. How are the Magic looking for playoffs?
Things are looking very well. We sit in 8th place, but we're 5.5 games ahead of 9th place, which would be out. And we're only a half game out of 7th place with the Brooklyn Nets. So we have 8 games to make up a half game and hopefully move into 7th place, which would hopefully increase our playoff chances.
All right. Well, we will keep our fingers crossed and watching the games. Thank you so much for being with us, and stay safe.
Thank you very much.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep you informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.